When you're questioning BPPV, you really should know, even before you do any objective testing, majority of the time, you'll be able to tell just by their subjective history. There's actually a study that showed that there's like 92% of the time, 92% specificity that you can rule it in by just their history. So the key things you're looking for with the BPPV is that it's episodic vertigo, so it's not constant, and that it's triggered. So those are the two key terms. It's episodic and triggered. It's not constant, and it's triggered by very specific motions. So the most common is the getting out of bed, but other things are, every time I turn quickly, every time I bend over, or when I look up to get something in a cabinet or wash my hair. It's very specific triggered motions. It's not going to be I was just, sitting there and got up and felt a little dizzy, or I was walking in a store and just it's not those vague. It's very specific triggered motions. And then the other little tidbit I have for BPPV is if they're not sure what ear the problem is on, because sometimes they're not sure, especially if it's in the vertical plane that they have problems. A very simple test is called the Fukuda test. So you're going to have your patient stand. Here, we'll turn this way. You have the patient hold their arms straight out in front. You have them close their eyes, and you have them march in place for, technically, I think the test is 30 marches. Obviously, you have to make sure that they're safe enough to do this. Now, everybody goes forward a little bit, so that's fine. Keep your eyes closed. You're looking for if they deviate to one side or not. So if someone as they were marching, goes like this, and the cutoff is, I think, 45 degrees or more, then they have a problem. It's the right side, so the same side of the ear that's affected. If they just go forward, it's not considered a significant finding because everyone goes a little bit forward. Okay, you can stop. So that's just a little tidbit I do sometimes before I get them on the table if they're not sure what ear it is.